I'm Allie Yarrow. I am a journalist and the author of Birth Control: The Insidious Power of Men Over Motherhood. Birth control kind of started, I think, about a decade ago when I became curious about pregnancy and giving birth. And when I just started to ask everyone I knew their birth stories and their experiences. But the book itself, I started writing, I would say, about 5 years ago. And it combines deep reporting, expert interviews, an original survey of 1,300 women and birthing people about their experiences. And
Wait, no, hold
also,
on. You just said that like you rattled it off. That's so big. Say that again. The original. So you surveyed how many women?
1,300 women and birthing people about their experiences. I put a survey out into the world. I created a survey and I put it out into the world. And I thought if I was lucky, like maybe we get like 30, 40, 50 people would fill this thing out, but it just kind of flew all over the place. People really want to share their stories. People really want to talk about their experiences. And there aren't a ton of avenues to do that. So I think the invitation to talk about them, and it was a combination of sort of, question and answer and free response. And, there are a lot of disturbing findings in the data. Many people between 30 and 40, I think that the most recent study from like actual trauma experts found that 45% of people describe their birth experience as traumatic. And many people in my survey did as well. What I found to be so heartening is that even for people who had traumatic experiences or difficult birth experiences, so many of them said, if I can share my story, I will do that if it can help someone else. My goal is to like have this help somebody. And I think, we need that. We need it so badly. I really have started to say, and I believe that storytelling is life-saving. It's part of the solution here because we live in a system of women's healthcare, of childbirth, where we are not educated about what is possible. I mean, from a very early age, even, growing up in Georgia, the sex education I had was abstinence only. There's still like more than $1 million a year, like more than $100 million a year in this country. Sex education funds goes to abstinence only education. So like, this is stuff we're not learning from a very early age. We have to tell our birth stories so that people know what's even possible.
Right. Oh my God. So how did you go? This is so interesting. I've been fascinated about mindset and how we're raised versus what we end up believing. How did you go from an abstinence only curriculum to being as feminist and progressive and out there and amazing as you are? Like, you talk a little bit about that?
I did not even take a women's studies class in college. I did not think feminism was for me growing up because it was something that was derided and sort of mocked. And Hillary Clinton was a big public figure, and sort of her association with that term was really just negative in the place that I came from. And I think in much of our country. And it just took a little bit of, digging and unpacking and meeting the right people and reading the right books and sort of finally having the right ideas kind of like come up to me for me to realize that, oh, this is like feminism is about humanity. It's about human rights. Like that's what it's about. And I think it just was sort of a matter of, a light going off for me. I think it probably started too in like early newsroom jobs that I had where I would pitch stories. Actually, I worked for a health show on a major network, and I would pitch stories about women's bodies and health, and like I would pitch them, and producers would say like, oh, like I don't want to say vagina, like we're not going to say vagina, like we're not going to say vulva, we're not going to talk about women's bodies in that way. And that was sort of a lesson too, and like what's acceptable to cover here. It's like journalism, we can all talk about journalism being sort of both sides, but it's subjective too. There's a lens. And in talking about health and reporting on women's health, like to not speak the parts of our body is, I mean, that's part of why we are where we are right now.
Yes. Yes. And also, I just keep thinking like news covers the most violent, horrific stories, right? And that's okay. But saying vagina and vulva, where like all human beings come from, like it's crazy to me. Oh my God. So just realizing the attitude towards women helped you realize you wanted to fight for women.
I think so, yeah. And just sort of becoming kind of understanding my own body and what kind of healthcare it required and sort of what parts it had was part of this journey too. I went on to sort of work in a newsroom and cover abortion and abortion politics and lawmaking around abortion, in part because I didn't understand what abortion was and I was afraid of it. And I thought that if I could sort of report it out, then it would become more clear to me. And I think I've done that a lot over my career with just sort of being afraid or not understanding and wanting to learn more. And so doing a lot of reporting, but always about the body, always about like the corporeal experience being in a female body. And I think it's just important knowledge, obviously, not only for those of us who have one, but for everyone, because we can tell from Dobbs and from all of the restrictions in abortion access that people are facing in this country today. Like this legislation, these people who are making this legislation and folks who have sort of like in the Democratic Party too, who have kind of turned their back to this happening for decades, are people who don't understand the basics of how pregnancy occurs and of how, the female body works, like what a uterus is. That's how these bans have manifested in all of our ignorance about the female body.
Right. And the fear, and again, the hatred of women. Like there's also that, the like power of women, like that. Possibly it comes from, I don't know if you came across this, but possibly it comes from a deep fear of the power of women. And so wanting to suppress that and control it. Yeah.
Yes, absolutely. I mean, we literally can create life with our bodies and birth it into the world. Like that kind of generative power, it's more power than white men have, for sure. Yeah. Right. And obviously it's the kind of power that if you don't have that kind of power, you fear it and want to control it. Yeah. And that's why we are where we are today. I try to, I talk about birth trauma and all the problems with the system and how women and people giving birth are not getting the care they need. But at the heart of this is like, we do this incredibly powerful, transcendent, life-altering thing. And that the fact that it is the power that it is why it's being controlled. The system has to be dismantled. It is incentivizing the wrong things. It's incentivizing intervening care that isn't safe. Most people don't need the level of meddling that is happening in a hospital birth environment. And yet it's done because of cost. There was a report that found C-sections at one particular hospital could cost anywhere from $6,000 to $60,000. NICU care is incredibly expensive. The room that you give birth in is incredibly expensive. A labor and delivery suite has to be able to convert into a surgical suite. So whether or not you need surgery, you go into that room and the hospital can bill a higher rate for that room. That's why if you go to hospital and you're laboring and they're full, you can't just go to another room because they can't bill you at the same rate for that room. So there is a completely backward, incentivizing the wrong thing core to the hospital care that has to be dismantled. I don't believe we would tolerate this kind of medical care if it were being done to white men, right? We're doing this kind of care to women, to Black women, to brown women, to trans people, to non-binary people. We're doing this kind of care to people who are already in bodies that our society at large disrespects, dishonors, and does not validate. So we have to question these systems because these systems were not built for us. So we're entering into a system believing we're going to get a certain level of care, life-saving care, heroic care, non-traumatic care. But we have to question that because of everything that we know about the way that we move in the world in these bodies. The first chapter of the book, I interview 3 10-year-old girls about their sex education experiences in Brooklyn recently. And because I wanted to know, like starting out, are they learning anything different than what I did? Like, are they going to be better prepared for this? When I was trying to get pregnant for the first time, I did not know that it was only a couple days a month you could get pregnant. I thought you could just get pregnant at any time. And many of my survey respondents said the same thing. Like they had never been taught that you could, because it was the education that you get is like, don't have sex because you'll get pregnant or AIDS. That was like the 90s and the 2000s. And, like birth control, get on birth control so you don't get pregnant. There's no sort of like filling in like now that you want to get pregnant, like where do you get that education? Like, how does that happen? And so I wanted to know what these girls were learning. And what they learned was that boys and girls hit puberty. People with penises, people with vaginas hit puberty. Stuff comes out for both of them. For boys, it is, it's sperm and it feels good. And it's something they can do to relieve stress. And for girls, it's blood and it's gross and you have to clean it up. And you don't want to necessarily like go to the school nurse to have to do that. They don't have tampons in the bathroom, but you have to go to the school nurse for tampons or for pads. And it was just like, that was the messaging. There was no messaging about pleasure for girls, sort of like feeling good in your body after puberty, the feelings that go along with the changes that are happening in your body. And so like we have to start, education obviously has to be part of this, but so does open conversation about the ways we learn about our bodies, about sex, about reproduction, about birth. And we have to question the systems that do not serve us and do not teach us. During the postpartum period, women have a baby and then they go from being completely surveilled to totally ignored practically overnight. So you're going to the doctor, so many appointments. And then once the baby's out, insurance or Medicaid typically only covers one more visit with your healthcare provider. And that doesn't happen until 6 weeks later. And that's far too late to catch major problems. We know that more than half of maternal deaths that happen, in conjunction with a baby being born, happen during that time. We need to be seen. If you have a home birth, like one of my births was a home birth, a midwife comes to your house like the next day, a couple days later, you're getting care as a dyad, you and your baby. That's what we need to have for everyone in this country. Everyone needs to have that kind of care because the amount of risk, about 95% of people have a risk or need that's unmet in the postpartum period. That's almost everybody. There isn't universal screening for the perinatal health conditions like postpartum depression, post-traumatic stress disorder after a birth. People have a hard time conceiving that you could have a traumatic birth and that it could cause PTSD, but you can, and it does. And those things go missed. They go unscreened for. And it's important that they are screened for because there's certain therapies and medications that can be really helpful during that time. Also, there are issues in your body with function that need to be addressed. Diastasis recti and pelvic floor problems are very common. They can lead to incontinence, prolapse, where your organs are sort of falling into your vagina. Like that's not normal. You need help with that. Things don't just come back together. You need to be seen. You need care. Pelvic floor physical therapy should be mandatory for everyone. About a quarter of people go back to work 2 weeks after having a baby. And they don't have any of this care. And that's just completely criminal. It's insane. It's insane. And so we can't show our children, our boys, that this is what we think of mothers. This is what we think of the postpartum body. We're just going to let it go. We're just not going to take care of it. And it is, you do see it, I think, when you're a child. You understand and you internalize care and there not being care and someone having to sort of step up and care for themselves. But that's not what should happen in the postpartum period. I mean, that is a time when community should come together. It's when, you should be supported by all the people who love you, but you should be supported by the government. You should be supported by your job. You should be supported by our healthcare system. All of these systems need to come together with paid leave, subsidized childcare, healthcare coverage here. There's so much that could be done by our systems to better this experience for women and for families. And it's not just about people not getting what they want or need. It's about this has generational impacts. If you have PTSD, I mean, some of the best research being done on PTSD after childbirth is a lab at Harvard run by Sharon Deckel. And she's finding that, if a mom has postpartum PTSD, that affects the baby. And it doesn't just affect the baby, but it affects the baby's baby. This is intergenerational trauma that's happening. And it's there in the research. This isn't someone's opinion. And we have to be cognizant of that.
This leads to my next question. The dismantling of these systems, what needs to be implemented? What would that take?
One thing that would make a huge difference is if we were to acknowledge that costly intervened with birth isn't worth it. If we were to be able to convince in our country insurers that this stuff can be happening for a much lower cost, that could incentivize change. There was one hospital that I reported on that the major reason they were entering a program to try to lower their C-sections is because they had tried everything. And they had tried everything because their insurer approached them and said, there are too many C-sections happening at this hospital. We have to reduce the number. We're not going to pay for these anymore.
Oh,
And
wow.
that's a huge force, right? So I think if we can reorient the financial incentives here, birth does not have to cost $100,000. Most people can give birth physiologically with less intervention, and certainly not intervention that costs tens of thousands of dollars. I think that would be a really an economical and a practical approach. There's a mindset shift that's really important here, and that is the birthing person, the woman, is the expert in her body and in her experience. The midwife's model of care supports that. And we need to sort of consider birth in that way. And if we shift the focus, if every one of the 4 million people giving birth in this country today wanted a midwife to take care of them, that could not happen. There are not enough midwives. So removing the barriers to entering the profession of midwifery that have been just laid by, generations of obstetrics deciding that it wanted control of birth and it didn't want anyone else to have it. We have all kinds of laws that have tried to regulate midwifery out of existence. Like midwives have to, they have to have a nursing degree. They have to practice in a hospital. Direct entry midwives have so much trouble just like taking care of birthing people who say, this is the kind of birth that I want to have. And we have to remove those barriers, and we have to like bust up that legislation and protect the right to having a midwife attend your birth wherever you deem that birth be necessary. So that's just a mindset shift of like changing it from like the expert, the doctor, like what we say is best, to no, the person giving birth actually knows what's best for them and for their body, whether or not they've read every study and every book.
What do you think parents of boys, and I know you're a parent of boys, can do to help shift mindset early enough so that you have more allies, like male allies, that you have boys becoming men who don't want to control?
I think we as parents can be brave, and we can have these conversations with them about periods, about birth, about sex. I mean, I talk about birth with my kids, and I did very early because I had my third birth was a home birth, and there was a good chance that my kids were going to be present for it. So I needed to inform them about what happens. And so we got great books. And whenever I have a question, a parenting question, and I don't know how to answer it, there is probably a fantastic book about it, a picture book that we can read together, and we can sort of get through that. Like we've done that with moving to different place. We've done that with, like potty training and like every sort of thing, that those things exist for the body and for birth too. We read this amazing out of print book about home birth and about what happens in a home birth. And it showed, my son would laugh at it and say, oh, it looks like she's pooping out the baby, my 6-year-old. And it's like, okay, yeah, like that's what you think it looks like. That's fun. I can see why you would think that's funny, like validating. I try to validate like his reaction, and not shame it.
Yeah.
But it's like, actually like this is an opportunity for me to tell you, a baby comes out of a vagina, and it does look like it's coming out like, the butt's right there too, right? Like I see why you say that. But it like vaginas are very stretchy. Babies can come out of vaginas, and they can also, sometimes they need to come out of the tummy. Sometimes in rare circumstances, they need to come out of the tummy, but often they come out of a vagina, and the vagina just goes back to the way that it was. And it's really like, it's just something that we kind of have normalized. And it's not like, I'm not saying like, oh, I'm such a good parent. I'm saying we've had like pitfalls with this stuff too. Like we don't always get it right. But I think what I always come back to is these are conversations that you have over like your lifetime as a parent of a kid, right? You're not having one conversation about sex, one conversation about birth, like the kind of way that we were brought up to imagine there was a single conversation.
Yeah.
It's many conversations. And sometimes it's like, oh, I didn't tell you that part, or, oh, I got that a little wrong last time. Like it's like editing, it's evolving. It's like the relationship itself. And so I think that's really important. But I also think, what we were talking about earlier about just sort of validating their experiences in their own bodies. Like you said, if boys feel powerful in their own bodies, they're less likely to exert control or power over other people's bodies. And so supporting that as much as we possibly can is just, it's the ball game.
Right. And along those lines, something that I've come across is because I think girls and women have been so mistreated and been controlled, I think sometimes it's hard to focus on empowering boys, like that there's resentment and there's like, I don't want to.
I'm careful about not saying that it's women who need to fix this. Like, we are not, right? Like, it's not our job to fix this. And yet we exist in this system where we are traumatized giving birth, where we do take on everything. And it's not expected that male partners in heterosexual relationships contribute an equal amount. And so I think, being as honest as we can be about that with our families. And also, I think sometimes it's like being okay with things falling through the cracks, right? Like, it's like, I just can't do it all. You can't do it all. We just can't do it all. Like, mom's not perfect. Let's see that. It's so interesting. I have a very emotionally intelligent son who I've started to try to talk to about feminism and about my work and about sort of like at a little bit of deeper level. And he, I think at first was like very sad, was like, do you like girls more than me? Like, like the really like such a pure and honest response. And I had to like think about it and try to unpack and explain to him, like, no, that's not what I mean at all. That's not what this means. There are systems and I don't think I'm there yet, honestly, with him. I don't think I've really been able to explain it to him in a way that he completely understands, but I'm so grateful that he's brought it up, that he brought his like real feeling to me about this in a way that like, he's not asking me to like fix the feeling. And I think sometimes we as women, like with our kids, with our partners, it's like, we want to fix it, right? We like leap to fix this like sad or this mad or whatever it is. But I think, what's important is that what it shows me is that we have the kind of relationship where he can come to me with this feeling and this question and this realness, and that we can have a dialogue about it. And I haven't figured out exactly what to say to him yet to explain that my work is rooted in feminism because of systemic patriarchy, and there are ways in which boys and men benefit from the world in ways that girls and women don't, historically and today. But he doesn't see that and feel that because he sees and feels being a child.
What does your husband say and do? What's his role in that?
Yeah, I mean, he's aligned with me on having these conversations. Like, he talks about all of these topics with our kids, just like I do. It's something that we're really aligned on as a family. And we're supported by an incredible school system and community that is really invested in anti-racism and in feminism. And so it's really like, it is in our air that we have created by like being where we are, which I think is really important. And I know not everybody sort of has that. But it was really important to me, like growing up in a place where there were a lot of ideas that like didn't track with the way that I wanted to live and the way that my family was. I mean, we were like a bunch of progressive Jews, and it was like, this is us, but like, we were in a kind of a hotbed of evangelical, like stuff. And it just wasn't always the conversation. Abortion was hush hush and you didn't talk about it. And most people didn't vote on it. And so for me, it was important to be in a place and be partnered with a person who was ideologically aligned with me on this stuff.
I guess just as a last kind of question, because because I'm doing Build Up Boys and so trying to change the way women and men interact with boys and helping them to not assume the whole boys will be boys and to recognize them as whole feeling people that get stripped of their humanity based on their gender pressure. And obviously girls have had gender pressure that they've had to overcome, and there's so many programs for that, but there's this dearth of programming for young boys. And so just how boys and men can be part of helping this, like what can be done differently, whether it's a mindset or action to help this. It's like, how can we teach our boys and men to be allies and advocates for women's health, for women's well-being?
I love what you're doing. My boys need it. All of our boys need it. They all need this validation and this support. So thank you for what you're doing. Men are in the birth room. right? Like many people have male birth partners,
Yes.
and they shouldn't just be there holding hands. They should know everything the birthing person knows and should be able to advocate on a whole nother level. Like it's this wildly untapped resource, is like men understanding pregnancy, understanding nutrition, going to all the visits. It's like you're there anyway. Be that person, be that support, like have the level of understanding of your wife or girlfriend or partner's body so that you can speak to their needs in critical moments. Like we see this again and again, and there are really amazing programs that are sort of trying to tap into this resource of men to better support birth. But I think for boys, I mean, seeing the men in their family do that, to
Do
see
that.
the men in their family become involved in birth, go to those visits, have those conversations, because by and large, I mean, the messages that they're still getting from the media about all of this is like, this is a women's realm, this is a women's domain, like this is over here, and this is not for me. And we have to shift that. Birth has to be for all of us. It has to be something that we talk about and we share. I mean, I tell my kids their birth stories every year on their birthday because, and I want them to know. I want them to know where they came from. And sometimes I just tell them, you know, not on their birthday. Sometimes something like reminds me of something that happened that day. And I'll just say like, well, when you were born, I love talking about them being born. And so many of us, like, do we even know what our birth stories are? Do we even hear them? Are they sacred? Are they part of our family narrative? And for me, I think that's what I want for my boys and for my daughter. I want them to be part of a narrative that celebrates the creation of life, that celebrates their lives, that celebrates women being powerful, giving birth, like having this just unbelievable generative power, and that it isn't victimhood, that it's actually power, and that they can be part of that.
Right. And if boys see people celebrating women's power, then that shifts to all other areas of life, right? Because then it's
100%.
right, like it's okay, it's safe. I don't have to worry I'm not less than because I'm celebrating this, right? Which
I came from women's power,
yes,
right? Like that's essentially it.
yes, I love that.